Assalamu alaikum viewers. Today in this video lecture we will learn all about the dental implants and we will learn all steps of placing a dental implants. Let's start. First of all, what is dental implant? Dental implant surgery is a procedure that replaces tooth roots with metal, screw-like posts and replaces damaged or missing teeth with artificial teeth that look and function much like real ones. Dental implant surgery can offer a welcome alternative to dentures or bridge work. Different steps involved in the procedure of placing a dental implants. Step 1. Planning with doctors. You will determine how many teeth you want to replace with implants, which could take some additional planning with other dental specialists like periodontitis depending on your health condition. You will also discuss all of your medical conditions and medications depending on your condition or orthopedic implants. You may need to take some antibiotics before surgery to avoid infection. Step number 2. Tooth extraction. If you still have a remaining tooth that needs replacing, your dentist will remove it before the dental work is performed. You can have this done at the same time as the implant insertion. Step number 3. Graft the socket. To simplify the eventual placement of the implant, it's important to preserve the bone of extraction site by grafting the socket. First, any granulation material should be carefully removed from the socket with a surgical cutter. This side should then be irrigated and this wall scraped with a crank-up-length scaler to initiate some bleeding. At this point, the socket is filled up to the crest of bone with grafting material, either synthetic or allograft. This side can then be closed with a simple X suture. Step number 5. Place the implant via flapless surgery. After the socket size has healed, the patient returns for placement of the implant. By following the previous steps, the buccal plate should be intact and the site will have adequate ridge height and width. The site can be evaluated intraorally and radiographically to verify sufficient bone volume for implantation. Step number 6. Take some rest for the purpose of healing the jawbone. After the implant is added to your jawbone, the jawbone will begin to grow around the implant. The implant then becomes part of your natural gum line. This process varies by person and can take anywhere from 3 to 9 months. Step number 7. Abutment placement. Once your implant is stable enough, the dentist will place an abutment on top of the implant. This piece connects the implant to your crown. The abutment needs to be tightened so it stays in place when you eat. Step number 8. Take final impression. Approximately 3 months after implant placement, the patient returns for the final impression and the healing abutment is removed. This will reveal a healthy and aesthetic soft tissue collar around the implant site, which has been guided by the healing abutment since implant placement. An impression coping is then connected to the implant. Final step. Deliver screw retained crown. The dental lab fabricates the definitive restoration based on the final impression. Screw retained crowns are aesthetic, predictable, easy to deliver and an excellent choice for single tooth implant cases. A crown that attaches directly to the implant also avoids the task of cementing the restorations over an abutment and provides easy in retrievability.